Jess Phillips, hello.
Hello.
How's it going?
Well, it's just weird. I'm still not used to this way of working, but other than that, it's fine.
Likewise. I'd like to talk to you today about coronavirus and domestic abuse. Perhaps we could start off, if you could provide some context, explain a little bit what sort of impact coronavirus has had on incidents of domestic abuse.
Well, I mean, it's quite obvious, and it has been quite obvious from the beginning that isolation would cause not necessarily more domestic abuse, but those suffering domestic abuse, their risk would massively increase. They're less likely to be able to escape. They're more likely to be locked in with somebody who is abusing them and their children. And the figures that we currently have show a nearly 50%, a 49% increase in the number of calls going to various domestic abuse helplines. We're seeing in London, certainly, seeing an increase in domestic call-outs to the police. There have been 4,000 arrests over the last 6 weeks. And that's 100 a day, people arrested for domestic abuse in London, and that's higher than we would normally see. So we are seeing that, unsurprisingly, a period of isolation and lockdown in our homes is not safe for everyone.
I mean, there's another layer to this as well, isn't there? Which is that in the instances of child abuse, schools are often a place where that abuse is flagged up, and that's not an option right now. They've been shut. I mean, how can we fill this safeguarding void that the lockdown has created?
Well, I mean, you're absolutely right. Schools, places of work, just even being able to go around to see your friends and family, these are all release valves in an ordinary, dangerous life. And it's going to be difficult. There's nothing anyone could do that would eliminate the risk. We don't live in a risk environment in this regard when we're not in lockdown. But what we can do is we can put in place as much as possible a first point of contact where people would have been in their schools, they would have been at their workplaces, they would have been going to their GPs. We can put in place a first point of contact that is very responsive. But then we have to make sure that there is plans past the first call, that there are places for people to go, that there are people for children or adults suffering abuse to talk to be able to manage their risk and speak to experts who can help them. But in the worst cases, we need to make sure there are places people can escape to.
Presumably you would agree with the sentiment that whilst it's important that we're talking about things like PPE and testing and all this stuff, that we should not lose focus, lose sight of these equally important issues, domestic abuse being just one of them.
I mean, absolutely. I think that any government strategy from the beginning absolutely has to prioritise the health service. But there should always have been a very clear strategy for safeguarding adults and children who live in abusive homes as the government decided on the lockdown. And there should, as much as we need to make sure PPE is working, as much as we need to make sure testing is working, we need to make sure this is working, because for millions of people in this country, home is not safe.
So is it your view that then perhaps this has been slightly overlooked by the government?
I mean, it definitely has been overlooked. They're sort of catching up now and sort of scrabbling around for different pots of money. But it should have been core from the beginning when lockdown was going to be the strategy, which everybody would agree was the right thing to do. There should have been a proper strategy for how they were going to deal with the things that would go wrong for people during lockdown. To date, not a single penny of extra crisis funding has reached the front line. Not the £2 million that Priti Patel announced weeks ago has actually reached even the helplines that are a very vital first point of contact for people. This isn't good enough, and it's a scandal of poor organisation that it is just very well mirrored with the issue of PPE, a lack of preparation, a lack of proper joined up thinking and strategy seems to have gone into vulnerable children and adults, and certainly the domestic abuse sector is struggling.
What advice do you have for someone if they suspect that domestic abuse might be taking place?
My advice would be is to reach out to someone, to reach out to the national domestic abuse helplines, to reach out to even friends and family if you can. But that there is help out there. The courts are still operating in a different way, but they are still operating. The police will come if you call, and there are people who can help you. It is very dangerous for people to call at the moment, and so there are other options, web-based apps that people can use to reach out for help, run by various local and national organisations. My advice would be is to keep yourself safe by reaching out.
And if someone feels in immediate danger, what is the best course of action for a person to take?
Always, in the lockdown, pre the lockdown, post the lockdown, if somebody is in immediate danger, they should call the police. And there is a way that if you call 999 and you cannot speak, if you wait until they ask for your name and your address, you press 55 on a mobile phone, they will be able to find you, but you have to wait till they ask you your name and address, because that's a special system that has been set up. But the reality is that if you are frightened for your life, the life of your neighbour, the life of somebody you love, contact the police.
Do you think there's a possibility that this crisis might refocus our minds on this issue, as it perhaps has done, in the case of the value of key workers or other issues? Do you think there's a potential here for us to really focus in on this as an issue and for it to get some of the focus that perhaps it hasn't in recent years?
I mean, absolutely. Sort of the cloud has a silver lining, is that people have realised what it would be like to be a prisoner in your own home, what it would be like to have yourself isolated from the people that you love so that you didn't have somewhere to turn. And I think that the sort of terrifying nature of how scary this must be for some people have got much more empathy for it at the moment. And so, yes, I really hope that this sort of moment of public consciousness reaches out and that we can change the way that we deal with this issue in this country and make it a real priority.
And obviously, as well, the bill going through the House of Commons at the moment, albeit virtually, some very powerful contributions during that debate. I mean, is there anything that particularly stood out for you, and anything that you'd like to draw attention to now?
Well, always the personal testimony from my colleagues is moving, from my colleague Rosie Duffield, who talks about her own coercive control, but the new MP in Bolsover, Tory man, and it's often women speaking about this, stood up and talked about what it was like to be a child and an adolescent growing up with domestic abuse from his stepfather. And that was very powerful, and it is always powerful when men's voices are heard in this debate. And I think as well, just quite a lot cross-party, people agreeing, and I think it goes to what we say about appreciating key workers now, the need for the bill to make sure that it addresses supporting everybody who needs it, including migrant workers. And currently the bill is not good enough in that regard. And I think people are having a moment where they see the humanity in all of us. We realise we're a herd and that we need each other.
Jess Phillips, thank you very much for taking the time. I really appreciate it. I will return the internet connection to your family now.
They'll be pleased. They can play Roadblocks or to their heart. Is that? I don't even know whether that's what it's called, Roadblock.